Welcome back to Homeo Vision and a very good day to all of you. I am Dr. Gauthami Deshmukh, and in this third video of Organon of Medicine series, let us understand aphorism number 3. First, let us read out the third aphorism. Alright, so here Hahnemann says, if the physician clearly perceives, let us make a note of this word, perceives. If the physician clearly perceives what is to be cured in diseases, that is to say, in every individual case of disease, if he clearly perceives what is curative in medicines, that is to say, in each individual medicine, and if he knows how to adapt according to clearly defined principles what is curative in medicines to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue, to adapt it well in respect to the suitability of the medicine, most appropriate according to its mode of action to the case before him, as also in respect to the exact mode of preparation and quantity of it required, and the proper period for repeating the dose. If finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judiciously and rationally, and he is a true practitioner of the healing art. So this is a huge aphorism, and in this video, I will just be giving a brief description of what this aphorism means, but in order to get a in-depth understanding of what this aphorism actually means, I would definitely recommend all of you to please go through Organon of Medicine by B.K. Sarkar and A.K. Das to get a deeper understanding of what this aphorism is trying to tell us. Now, let us have a look at what this aphorism means. So, in this aphorism, Hahnemann is trying to tell us what must a physician know in order to treat judiciously and rationally, and what must a physician know in order to become a true practitioner of the healing art. So, here the healing art definitely refers to our homeopathic system of medicine. So, in this aphorism, he is telling what knowledge must a physician acquire in order to treat his patients judiciously and rationally, and in order to become a true practitioner of the healing art. One more thing that we have to pay attention here is throughout the aphorism, he has used a phrase that is to clearly perceive. So, what does this word perceive mean? Perceive means to not merely look upon something. Uh, Perceive actually means to understand something with reasoning. So, understanding with reasoning to apprehend that particular thing and to analyze the patient and his suffering when we have a patient in front of us. So, we should not just merely look upon something and try to assume things about it, but instead, we will have to perceive the suffering or the patient who is suffering right in front of us. We must understand, reason, and analyze whatever is there in front of us. So, this is one word that Hahnemann is trying to emphasize upon. Next, let us have a look at the knowledge that a physician must acquire in order to become a true practitioner of the healing art. So, here we have Hahnemann, he says, uh, a physician must clearly perceive what is to be cured in a disease. So he says the knowledge of the disease is very important for a physician. So a physician must know all the symptoms that comprise a disease. He must know what common symptoms the disease will exhibit. And only if he knows the common symptoms, only then will he be able to individualize a patient homeopathically. Isn't it right? So once we know a disease and its symptoms, we will know what the common symptoms of a disease are. So once we know the common symptoms of a disease, when a patient presents to us, we will also know the uncommon symptoms, as in we will also know the PQRS of the patient. Thereby, we will be able to individualize a patient, which is something very important and peculiar to our system of medicine. Here, Hahnemann also tries to tell us that the disease that he is referring to here is not just a is not just the structural or the pathological changes. It is not just the disease name that he is referring to, but he is referring to the condition of the whole suffering living organism. So he is referring to the condition of the suffering living organism. Okay, so we must clearly perceive the condition, the symptoms, and the signs of the suffering patient who is right there in front of us. It is not the structural or the pathological changes that we must pay attention to, but instead we will have to pay attention to the symptoms of the deranged vital force. Symptoms of the deranged vital force. This is what Hahnemann is trying to tell us. So the physician must clearly perceive the knowledge of the disease, and he must also know, by knowing the common and the uncommon symptoms, he must also know what is curable in a disease, what symptoms are curable in a disease, or what is to be cured in a disease. This is the first prerequisite or first knowledge that a physician must acquire. Second, he says that a physician must clearly perceive the curative properties of a medicine. He says the curative properties of a medicine is also very important. And as a homeopath, we all know that the medicines are proved in our system proved on healthy human beings. I'm going to abbreviate this as HHB. It is healthy human beings. So when a medicine or a drug, when a drug is proved on healthy human beings, we get a set of symptoms. These set of symptoms are the symptoms that this medicine or this remedy can cure in a deceased patient. So this is the knowledge of medicine that we need to have. We will have to individually prove every remedy or every drug on a healthy human being and collect the set of symptoms. So whatever set of symptoms that we will be obtaining at the end of this proving is going to tell us what disease symptoms that particular medicine can cure in a deceased individual. Third, he talks about the knowledge of application of the drug knowledge to the disease knowledge. So now we have the on examining the patient, we will get the symptoms of the patient. So now we have obtained the symptoms of the patient. Next, by all the drug proving that is done, we also know the symptoms of our drug, symptoms of our medicine or drug. Let us just write it this way: symptoms of the medicine and drug. Now, based on a particular law and based on defined principles, we will match these two set of symptoms. So we will have to match the symptoms of the patient to the symptoms of the medicine or drug. And by doing so, on matching these two, we will end up getting something called as the similimum. So this is the third point. So in the third point, he says the physician must clearly know how to adapt the drug knowledge to the disease knowledge. So we are going to apply this disease knowledge to the drug knowledge on basis of a principle, that is the law of similars. So based on the law of similars, here we are matching the symptoms of the medicine to the symptoms of the patient, and that particular remedy that we end up having at the end of this process is going to be called as the similimum. So the defined principle being used here is the law of similars, that is the similia similibus currenter. So these are the first three prerequisites that a physician must have. Going ahead, Hahnemann also says that the physician must know the choice of remedy. He must be able to correctly choose the remedy, again based on the law of similars. Law of similars, and based on the materia medica knowledge that he has, we will have to match the symptoms of the drug and symptoms of the disease with each other based on this law of similars and come down to a similimum, which is going to be administered to the patient. Not just the right remedy, but a physician must also know its exact mode of preparation. So the mode of preparation of different remedies or different drugs and medicines, this we learn it in our pharmacy subject. So, a knowledge of the pharmacy and knowledge of the mode of preparation is also equally important for a physician. Next is knowledge of the proper dose that is required and knowledge of repetition of dose. So, the knowledge of the proper dose and repetition of dose is referred to as posology. Posology is as important as the correct choice of the medicine. Sometimes what happens is that we will come down to a minimum very confidently. The remedy is perfect. But when you make a mistake in the dosage and the repetition of this particular dose, we might not we might not be able to bring about a cure in the patient. So this posology is as important as the correct choice of remedy. This is something that we must know. We will talk about posology in detail in the upcoming aphorisms, but for now, let us know that the knowledge of the proper dose of the remedy that we have selected and the knowledge of the repetition of dose of the remedy that we have selected is as important as the remedy that we have chosen itself. Lastly, the physician must also know the obstacles to cure. What might prevent a cure in this particular patient? So he must know the obstacles to cure and its removal. Say, for example, we have a patient coming up with some gastric symptoms, and these gastric symptoms are because of overeating. So we know that, and we have a patient presenting with these gastric symptoms, and we give him a medicine. But he doesn't stop overeating. He's still overeating. In that case, what is happening? Our remedy is not working on him because there is a maintaining cause, because there is a precipitating cause that is still existing. So now this overeating becomes an obstacle to our cure. So in such cases, the physician must be able to identify this particular obstacle to cure, and he must regulate the food habits of that particular patient. By doing so, we will be able to remove the obstacle to the cure. So these are the prerequisites, or these are the knowledge that a physician must acquire in order to treat his patients judiciously, rationally, and also in order to become a true practitioner of the healing art. So this is a very brief explanation of what aphorism number 3 is trying to tell us. If there are any questions, please put them up in the comment box below. Uh, do subscribe, like, and share for more content. Thank you.